Chief White House correspondent Major Garrett is joining us now from the lawn of the White House. Major, how will the president's announcement today on the opioid crisis actually change the country's fight against the epidemic? Is it a matter of different funding or funding coming from somewhere else? How does it change things?
So it sets things in motion at the Department of Health and Human Services, removing some regulatory hurdles to getting access to telemedicine and maybe applying some funds to substance abuse treatment that were not previously available. It also frees up some funding at the Labor Department. This is not a national emergency, and those have historically and by law been reserved for hurricanes, earthquakes, the fires in California, things of that nature. A public health emergency at a national level is also quite different from this one because those are short-term things dealing with infectious diseases. The last time we had a national public health emergency was 2009 to combat swine flu. The difficulty the administration encountered with the opioid crisis is it arose and has arisen out of the legally prescribed use of painkillers. Then people become addicted to those painkillers, the prescriptions run out, and then because they're addicted, they look for synthetic alternatives, fentanyl or heroin. And that's where the abusive behavior has frequently become deadly. But the underlying cause is pain and legally prescribed drugs. That's not like swine flu or some other kind of infectious disease. So that's why the administration has really been grappling with what to do and how to declare it and fit within existing federal law. The real question for this administration and the Republican-led Congress is, now that this has been declared a national public health emergency, will there be real dollars assigned to deal with all the various aspects of the opioid crisis? And right now, the administration has no dollar figure it's seeking from Congress. It hopes to get some funding as part of a resolved budget deal sometime next month. But this morning on a conference call, when reporters said, if this is such a big priority, if it's so important to the president, how much money does he want? No declaration whatsoever, because this administration doesn't know how much Congress can or will provide.
That's a good question, and we'll be looking to hear from the president very soon about that, Major. I also want to ask you about the budget. The House is expected to vote on the Senate's measure today. That's going to obviously pave the way for tax reform. So what are you hearing from lawmakers? What can we expect? Unity, division, like we saw in health care?
Very short answer. This is going to pass in the House today because it sets the framework, as you suggested, for consideration of a tax bill. We went through this process with the attempt to repeal and replace Obamacare. Reconciliation. You have to pass a budget first to have broad outlines, and then once you've done that in both chambers, then you can have a vote in the Senate on whatever you choose to, in this case tax cuts that only require a 50-vote majority or 50+1. That's what the Republicans need and want to do because they don't believe they can overcome an expected Democratic filibuster, which would require 60 votes. So the House will pass this budget framework today. Then next week, House Republicans are promising to unveil the details of their approach to tax cuts, and that's when the real debate, political and policy, will be joined.
Okay, so there's a lot of work to be done before lawmakers break for the holidays. There are all these public clashes, but are they really going to have an impact on the president's ability to push his legislative agenda forward? There are always the same handful of lawmakers who vote against his legislation, and neither of them are named Corker or Flake. So Is it really going to change anything? Or is it more just a matter of presentation? They don't like how the president presents, but in terms of, what he's trying to push, they're fine with it.
Well, that's what has been true up until now. Senator Corker from Tennessee, Senator Flake from Arizona have voted almost unanimously with the president's overall agenda. A couple of very small exceptions to that. They were not impediments to repealing and replacing the Affordable Care Act. Other Senate Republicans were. So on big issues, Senators Corker and Flake have been right with this White House. Now, are the things that they've said in the last few days their way of signaling to the White House, hey, on tax reform, don't expect me to be there? We don't know yet. So far, we have rhetoric, we have criticism about the president's temperament and his style, but nothing about his overall agenda. And if past his prologue, Corker and Flake, as the president predicted to us yesterday on the South Lawn, are going to fall in line. That's what we don't know. And a lot of that will become clearer once House Republicans put together and release the details of their tax reform and tax cuts, because if there are large deficit implications, certainly Bob Corker and even to a lesser extent Jeff Flake have said that could give them reason to get off the Trump train.
Major, we also want to ask you about President Trump's upcoming trip to Asia. Yesterday, you asked him about possibly visiting the DMZ. Let's listen to that sound and then let me get your reaction.
Mr. President, the DMZ, yes or no? Can you say definitively where you're...
Say it, what?
The DMZ, yes or no? Are you going, yes or no?
Well, I'd rather not say, but you'll be surprised.
What does that mean?
You'll be surprised.
What does that mean?
Yeah, so what does that mean, Major? I mean,
really?
I recall when I was in college, President Clinton visiting the DMZ and having that stroll across a bridge, which apparently set the Secret Service off in, they were really frightened about that. What does this mean for the President of the United States today?
No, Vlad, that's my question, okay? I get to ask that question. What does that mean? What does that mean?
I just love you asking that because that's what everybody's asking.
It's the daily question of my life. At least my work life. So there is a significant debate going on. The Pentagon, the State Department, at this White House about whether or not the president should go to the demilitarized zone between South Korea and North Korea. It's worth remembering they only have an armistice. They have no cessation of hostilities between South Korea and North Korea. And anyone who has visited the demilitarized zone, as I have with previous American presidents, knows it is a place that is very tense, very, very tense. So tense that U.S. Army personnel instruct any visitor to the DMZ who is a civilian not even to raise your hand above your waist at any time. Why? Because the North Koreans might interpret that as a hostile move and act accordingly. That's how tense things are at the demilitarized zone on a daily basis. Many American presidents have gone there to observe the North Koreans and to sort of project American defense of and alliance with South Korea. But I know those within the State Department and the Pentagon do not think in this atmosphere it's the wisest idea for the president to go to the demilitarized zone because it might be viewed not only as a provocation in the moment, but a continued provocation that would amplify already very intense tensions between North Korea and the United States. The president, I've asked him twice now. This is the second time in successive weeks I've put this question to him, and he has waffled on it. I think the president's inclination is he wants to go and project that American presence, but I think a lot around him say, Mr. President, let's choose a different time when this is maybe less tense than it is right now. As the president said, maybe we'll all be surprised, but eventually we'll find out.
To be continued. Major Garrett at the White House for us. Major, thank you as always.
Sure.